So it's 1:03. We will go ahead and get started. So good afternoon, and thank you for attending the City of Sacramento's Get Vaccinated Stipend program. My name is Lynette Hall, and I am the Community Engagement Manager for the City of Sacramento. We are recording this meeting for post-event publishing. Some brief background: the City of Sacramento received some ARPA funds, and the City Council requested and adopted a $1 million COVID-19 vaccination outreach campaign. As a result, the media and communications, as well as the community engagement team, have been working with the consultant Runyon Salzman to launch this campaign and outreach stipend program. Today, we'll be covering different aspects of this program, the application required to apply for this program, and some of the requirements for participating. If you have any questions, please feel free to add them to the chat, or you may use the Zoom feature to raise your hand. And we will address all of your questions at the end of the webinar. Data shows us that vaccination rates in the City of Sacramento, and I think we are one stipend ahead, one slide ahead. Data shows us, thank you. Data shows us that vaccination rates in the City of Sacramento really vary by zip code. The map on the screen shows us zip codes with low vaccination rates and high hesitation rates, which are outlined in red. And then we also have zip codes with higher vaccination rates, but moderate or high hesitancy rates. And those are outlined in yellow. Zip codes with high vaccination rates and low hesitancy rates are outlined in gray. This campaign aims to support community-based organizations with their vaccination efforts to increase vaccination rates in the areas where vaccination rates are currently lower than desired. As the map indicates, we really want to focus on the red and the yellow areas, with red being the highest priority. Please note that we are focused on activities that take place in the City of Sacramento limits. Your organization may currently be involved in activities in multiple zip codes, and even some that are beyond the city limits for the City of Sacramento. I would encourage you, however, when responding to the application, please focus your data and efforts on corresponding areas of the city within the city. Again, this program is meant to really amplify existing efforts to get folks vaccinated. We want to get folks vaccinated, low vaccination zip codes, and we will do that by awarding community-based organizations like yourself between $2,500 and $5,000. Grants will be based on completed applications. CBOs selected to participate in this outreach program may elect, based on availability of funds and the results of your efforts, to receive additional resources and funds to help scale up your efforts. Additionally, beyond the direct stipends of the $2,500 to $5,000, we also may provide additional support to your organization by providing marketing materials and outreach. And this may include things like social media posts and other digital messaging through paid meetings. We have designed a very, very simple application for organizations to complete. The application is currently opening now. It is open. Please be as descriptive as possible in your responses. Feel free to share as many details that you feel are relevant to your application. Please double check that the contact information provided is accurate. We may contact you for clarification on your responses as applications are being reviewed. The applications will be available through February 25th at 5 p.m. If I were you, I would get them in before 5 p.m. Ideally, candidates will be able to use these stipends to provide an increase in the vaccination rates in the community. Again, the emphasis is on the priority zip codes, and so make sure that those are outlined in your application. Applicants will be able and should be able to track their efforts. This is the most important aspect of this campaign. You should be able to document how the stipends were put to use and how many vaccinations could possibly be contributed to your participation in this program. We are willing to help with the marketing campaign again, and even boost your social media. We're also looking for people that are willing to provide people from the community to participate in this program. These should be people who inspire the community. It might be the executive director of your organization. It might be a well-known volunteer who engages with people in the community. We really want to personalize this campaign to reflect our community, but more importantly, this campaign needs to get people vaccinated. We want to make sure that you see people that you know and people that you trust on marketing materials. Please make sure that you have someone that is available to collaborate with the marketing team. They are on hand. We want to make sure that we can boost your social media posts, that we are able to provide you with the information and documents that you need to be successful. Boosting your social media will not come from your stipend award. We have a team available with the resources to be able to do that. Some of the information requested on the application will include the following. Please describe the community your organization reaches, include demographics, age ranges, ethnic backgrounds, social economic information, languages spoken in the home, anything that you may believe may be relevant. Also describe what you're currently doing and how you are doing it in a safe environment. We want to make sure that we're getting people vaccinated, but we're safely doing so. Also describe how your organization can help share in the messaging to increase vaccination rates. Please feel free to lean on your expertise in dealing with your communities. We know that you know your community best. We are interested in your creative methods to engage with populations that have experienced low vaccination rates. So again, please feel free to get creative, be bold in this space. We are providing applicants with the latitude to make the recommendations that you feel will most effectively reach the community, and most importantly, get people vaccinated. Last but not least, describe how you will track these results. I mentioned this before, but this is very important. We need to make sure that you are able to track where your efforts went. If awarded a stipend for this program, participants are expected to participate in the following ways. Again, please share on social media and any other digital platforms. If you have e-newsletters, we will provide the messaging, content, and images needed to accomplish this task. Identify a leader within your organization to participate in the marketing materials. Residents must see people that reflect them. We also want to make sure that we're providing personal experiences and that the quotes that are associated with these images really resonates with the community. Again, we have the staffing and materials and supports needed to make sure that we are increasing vaccination rates. As stated before, we really need people from the community. We need people that look like the folks that are our neighbors, that are in businesses that we support. I don't know, but I want to get back to normal. I miss people. I miss hugging people. So we all really need to do our part in getting vaccinated. I got vaccinated for my parents, not even for myself, but for them. So I encourage you all to join me into increasing vaccination in the city of Sacramento. At this time, I would like to open the floor for any questions. We will monitor the Zoom chat, or you can also raise your hand and we will call on you as well. Again, applications close on the 25th. If you have any questions, please email CE, like community engagement, at cityofsacramento.org. At this time, I will turn it over for questions.
Go ahead, Eric.
Oh, yeah, I just had a question. Is this particular grant
I guess, CBO restrictive, like depending on the partnerships that each CBO has? Is this restricted to only a certain type of CBO that doesn't have any existing partnerships at the moment already?
So it is not restrictive. It can be a collaboration, it can be an existing organization that, so no, not.
Lynette, you broke up there a little bit. Maybe mute and
I
unmute.
apologize.
Okay.
It is not limited. It can be a partnership or it can be an organization or an organization that is, collaborating with other organizations, that's fine as well.
Lynette, why don't you mute your mic real quick and then unmute because you came back a little garbled.
It is not. How I mic now? Can you hear me?
Still coming through kind of broken up.
Can you answer that question quickly?
Sure. So no, to answer the question, the stipend program is not limited to people who have existing programs. And also if you're partnered with a different organization, that's fine. We still encourage you to apply. Another question that we have in the chat is, what are some examples of acceptable uses for stipend funds? Can outreach volunteers be provided with mini stipends? If I would answer that if you can demonstrate that that will increase the amount of vaccines in your community and you are able to track that, as in we provided this many stipends to this many volunteers, and as a result, we were able to get this many more vaccines administered, I would say that's appropriate to put on your application, and then we will review that and either follow up with you or make a decision if that's acceptable. But that is, we want to provide the latitude for people to make recommendations on what they think will work best, and we will review all of that. So if that's your recommendation, please put that in your application. Zuri, you have your hand up.
Yes, thank you. What a great presentation. I'm so excited for this project. Can you provide the slide again, or the zip codes that are being targeted within Sacramento?
Sure, I can scroll back to that, and what we can also do is we can email this to everybody who's presented today. Please note that these zip codes do overlap into the county. So you want to stay within the city limits. Unfortunately, zip codes and city limits are not exactly the same, but we can share with you a map that will show you where everything is and where the city limits are, so you know whether you're inside or outside of that boundary. And again, these red zip codes are our priority zip codes, and then yellow would be the second priority, and gray, we already have a pretty high acceptance rate of vaccines, so those would be the lowest priority in the city. I hope that answers your question. Going down to Lynette, do you want to try your mic again? Let's see if it's any better.
Okay, is that a little bit better?
That's great. There you go. So here's Dr. Colette Charles. What if your organization is not located in the priority zip codes, but able to service the residents in the priority locations?
Yes, that is fine. As long as you are able to service residents in the city limits, it's fine.
And in those priority zip codes, yeah, that's. And then Maria Powell, the same question. Going down to Rick McPherson, will there be flyers and such where we can add our website info in order to keep track of those being vaccinated by our efforts?
So Isaac, I will go ahead and let you respond to how you want them to track their efforts.
So wonderful. So we will provide a tracking document that will allow you to monthly report all of your efforts, provide images of any events that you may have had, and the metrics pertaining to vaccinations that you were able to administer as a result of the stipends that you receive. So we will provide you with that. We will also provide you with a training webinar so that everyone is on the same page and has all the information they need in order to complete those timely. And then going forward on a monthly basis, we will review that. If we have any questions, we will maybe follow up with you and ask you to either elaborate further or provide more information. But as to Lynette's point, we are we're putting a high prioritization on recording metrics and making sure that all the stipends use is documented. Lakeisha Wells asks, what is the timeline for completion of the vaccinations? I believe this contract runs to what, the end of June? Yes.
Correct. We want to get people vaccinated as soon as possible so we can get back to normal. Any other questions?
We have other questions. Do applicants need to have their own EIN? What criteria do they need to qualify? For example, could a group of parents in a red zone apply, although they're not a formal organization?
So, no. So if you are a group of parents, you can apply as a group of parents. So you do not have to have your own EIN number to apply or be a 501c3. Again, I will reiterate, the purpose of this campaign is really to get folks vaccinated. And so, if it's parents, a part of a sports group that, people are looking up to and can get folks vaccinated, then we want to make sure that we support you.
This is Rick McPherson with the SACTO Foundation. That group of parents, the SACTO Foundation is always into collaborating. If you want to partner with us and get it done in a bigger way, I love that. We could touch a lot more people if we get our efforts and work together.
I do believe the chat feature is open, so I would encourage you all to please connect via chat. We love hearing stories like this of people collaborating.
Another question is the capacity a selection criteria? For instance, if an org can serve 4 red zones, will they be a stronger applicant or eligible for more funds than one who could only serve 2? I would say too that the application clearly states, what is your capacity and how many people. So I think, yes, if you have the capacity and ability to track increasing vaccinations in many red zones, your application would probably be a stronger one. There actually is a field in the application asking if you could scale up your program if you receive more support. So I would definitely recommend you be as descriptive as possible, extremely descriptive, and indicate that you could scale up if you think you could scale up. That's all the questions I see, and I don't see any other hands up. Is there anyone else who has a question?
Any other questions? Well, if there are any other questions, please feel free to email ce@cityofsacramento.org. We are happy to respond to questions. Again, I encourage all of you to get your applications in as soon as possible and not wait till the last minute. We want to get this kicked off as soon as we possibly can. So again, thank you for your time today. We are trying to get Sacramento vaccinated, and that is the purpose of this outreach campaign. I am Lynette Hall, and thank you so much for your time today. And Isaac, there's one other question around when will the selections be made?
Shortly after February 25th, after the close of the application period. Thank you.
Thank you all for attending. Have a safe rest of your week.
Thank you for having us. You guys be blessed and be safe.
Yeah.
Thank you.